Hi, I'm Dr. Jerome Zeckman, and I want to talk to you about total joint replacement preparation of your home. This is something you can do for any big surgery, but it's essential for recovery, and you want to do it ahead of time. The goals at Olympia Orthopaedics is to get you back to life you deserve, a life in motion. This includes safety, comfort, and getting a successful treatment. When I talked about benefits of preparing your home, I'm thinking about the necessary steps that you do prior to surgery. This will ensure a safer recovery. It'll give you a peace of mind. It'll make you feel more relaxed. You'll have less stress, feel more confident, and then you can focus on what's important, and that's your recovery. The checklist I put together is basic stuff. So number one, I want you to take a tour of your home. Number two, accident-proof your home. Number three, create a first floor sleeping space and set up a sitting area. You want to get everyday items into easy reach locations. Look into assistive devices. We'll talk about this. Consider installing handrails ahead of time in areas that might be a safety concern. And an important thing that you may not think about is to get your pets taken care of, because they can cause a hazard and may increase infection. Also, stock up ahead of time, preparing your meals and medications and etc. The first thing you're going to do is take a tour of your home. You want to note the number of stairs, identify any door sills or other hurdles. You want to go perhaps walk through your home with your walker. Look for the easiest and safest routes. You want to move furniture to make a wide path. Accident-proof your home. This may mean getting rid of throw rugs that might trip you up. Take care of mats that are on the floor. If there's electric cords that are in the way, tuck them away. You want to remove clutter. You want to move furniture to make that wide path. And you may consider installing night lights in case you get up at the middle of the night, you don't want to fall. Creating that first floor sleeping space may be very important, especially if you live in a two-story home and you sleep upstairs most of the time. This will be important during the initial phase of your surgery. Also, setting up a sitting area is an important thing to think about. You want to get the right chair. It has to be sturdy. It has to have good support. You may have to add a firm pillow if it's too low. At your sitting area, you may want to have a small table where you can keep your essentials. Put on it things like your phone, your television remote, your glasses, your medications. Get everyday items into easy reach locations. These may be things that you normally use all the time, but you don't think about it because they're low or high. So get them into an easy area, like maybe on a counter or onto furniture where they're easy to reach. This may include clothes, shoes, toiletries, dishes, glasses, medications, anything you use daily. Assistive devices can be very helpful. A walker is a must for most total joint replacements. A cane for later on, and a shower chair and a non-slip shower mat may be very helpful for when you take your showers. Other assisted devices such as a long shoehorn. There's other things called a reacher that helps you grasp low and high items safely. And there's a thing called a sock aid that helps you put socks on. Handrails. Consider installing these in bathrooms or in your shower. Also, look at your steps. If they do not have handrails, you want to consider installing some for increased safety before your surgery. Pets. Everyone loves pets, but they can be a hazard. They can be a trip hazard. They can increase your risk for infection. Ask a friend to perhaps take care of your pets during the early phase of your healing. Stock up on things. Look for groceries you might need, medications. Consider preparing meals ahead of time and freezing them. You can use ACE wraps to help with swelling, have those available. Compression socks are good to have. You might want to get a pair of those. It's easy to think about all these things, but preparing can really make your recovery a success, and it will be important, so try to do these things ahead of time. And remember, we're trying to get your life back in motion. So thank you for listening to this today.